So you can see that even though that there are different locations involved and different specialists involved, it's important to maintain consistency of having the digital record and the physical specimens married together and have that happening in the same system throughout. Because what's happening today, and one of the current problems that we showed on an earlier slide, is the data silos, in that the laboratory has their laboratory information system, the clinic has their electronic health record system. The pathologists oftentimes receive that information via fax. Today, we're still using fax machines in diagnostic medicine. This takes that out of it. Instead of having to send physical glass slides from the lab to the pathologist, where they could get lost or where there's human mislabeling errors, all of that becomes automated. And what we've seen is that automation is extremely important for patient safety, because most of the errors that occur in diagnostic medicine is not an analytical error on the pathologist side. They're oftentimes very good at what they do. They are specialized and trained, and they recognize the patterns of cancer and disease very well and very accurately. Unfortunately, what tends to be that problem is when you have the traditional 12 sample biopsies in the formalin jars, and you have to hand label each of those jars with the patient's name, their date of birth, and where that tissue came from, the odds of there being a mislabeling error, that it goes up and up and up the more things you have to hand label. And if the specimen is coming into the lab or then going to the pathologist, having it be mislabeled, even if a proper diagnosis is given, you could be treating the wrong area of the organ. And so automating these processes and creating a bridge, a digital bridge between locations, it is crucial for the patient's successful treatment and outcome. And